Before I hand over to the chair of our next session, I want to take just a quick 30 seconds to tell you a little bit about her. If you've managed to Google Maxine already, you'll have found out that she was on last year's Forbes' 30 Under 30 for founding and running one of the world's largest grassroots networks in the health tech space. What Google will have missed is that she manages to achieve the impossible almost daily, whilst being one of the friendliest and most supportive people in the industry. For some of you, this will be the first time that you'll get to hear from her. I can promise you, once she's done, you'll make sure that it isn't the last. I will leave you in her very capable hands. Maxine, over to you.
Thanks, Bilal. That's very sweet and very embarrassing, but thank you very much for such a kind introduction. So it is so wonderful to see so many people tuned in to this session. I've been very, very excited about hosting this for quite a wee while. So it's a fireside chat. It's meant to be quite relaxed. Make sure you got your cups of tea or coffee if you're 11sies. I mean, I think probably because we're working from home, we're all on like our 11th cup of tea by now, but it's meant to be very kind of chilled out and informative. So make sure you kind of sit back, relax and enjoy the conversation we're about to have. So many of you will obviously know Devi from being a sort of floating head on the news as well. But only getting a kind of 3-minute or 4-minute snippet into what her views and opinions are. So we've got a very indulgent 3/4 of an hour. So just a bit of housekeeping about how this is all going to work before we welcome Devi to the stage. We're going to have about 50% a conversation between Devi and myself. And then hopefully kind of the rest of the time will be great questions from you. So please keep them kind of brewing and mulling over, because it's meant to just be a real 50,000 foot from local and global conversations about the COVID response and everything between. So do keep your questions brewing. What we'll be doing is we'll be having the Q&A on the Zoom function live. Please make sure you ask your questions sort of fairly succinctly, because there'll be quite a lot of scanning happening, but also make sure you ask your questions sort of kindly and respectfully, because no one wants to see a sort of raggy, rude question. Even if it's a tough question, we like tough questions, but they can be done politely. We're also going to have a couple of polls as well. So if and my colleagues, Jessie or anyone else, can hopefully share a slide shortly with the polls. We'll just get a bit of an idea about, where you're thinking various opinions are and where you're at, and also who's in this room. So whilst we get this up and running, I'd love to welcome Devi to the virtual stage. And so we will kick off. Welcome, Devi.
Hi, thanks for having me.
So whilst Jessie and my colleagues get up her slide for us to get a bit of an understanding as to who's actually in the room at the moment, are you a researcher, are you a policymaker, are you a key worker? Maybe if you're a key worker, you're probably too busy being key and essential to come and have an indulgent 45-minute chat with Devi and myself. But if you could go onto slido.com and type in either 647 or use the QR code, it'd be really useful for us to get a bit of understanding as to who's actually in the room, so that we can make sure we're kind of tailoring our answers. So whilst you kind of let us know who you are and where you're coming from, and so we can decide whether we talk about the sort of nitty-gritty complexities of data or not, I just want to sort of start by welcoming Devi in the sense of Devi does a very good job of being wonderfully accomplished and making sure that humility is kept at the center of how she emanates that. So from Miami to Edinburgh, I'd love to get a bit of understanding as to your journeys to where you've been, from global health to now one of the kind of front runners in evidence and opinion on COVID. So it'd be great to kind of hear a bit of your journey whilst the audience answers these questions.
So my life in 30 seconds. So I'm from Miami, was born and brought up there, went to uni there, and then started heading north, and I ended up in DC for a while. Then I ended up in Oxford, decided it wasn't cold enough, so went further north to Edinburgh. I've been in Scotland now for I think 6 years, the university, really enjoying it here. And I've always been interested in the dimensions of public health. How do we keep people healthy? How do we prevent people from getting ill? It's much easier to stop people, let's say, getting sick than trying to figure out how to treat them once they are. And that kind of changed my interest from more of medicine, which is about treatment, to actually public health, which is about prevention. And I run a research team at the University of Edinburgh. It's called the Global Health Governance Program, made up of postdocs, PhDs, medical students, where we do research around different global health topics. And pre-COVID, we were working on infectious disease outbreaks and control. So a postdoc out in Haiti looking at cholera. How do you manage that in a low resource environment where you don't even have running water? And also one looking at maternal mortality out in India, another one in malaria in Senegal, Tanzania, South Africa. So we generally work across the world, and our whole team has had to pull together to basically put all that on hold and try to refocus our research and our advisory work around COVID-19.
Amazing. That was a wonderfully succinct and very global background as to where you've been. So just to kind of inform you me who we're speaking to in our wonderfully large audience. So maybe unsurprisingly, we're about 70% researchers, 22% members of the public, 7% key workers, and 3% policymakers. So just so we know who we're speaking to. Thanks for sharing the slide, Jessie. So kicking off, you're not an epidemiologist, you're not a virologist, you're not a vaccinologist, you're not any other ology that I'll probably not really know what it does anyway. You're a global expert operating at sort of the supranational level and looking at kind of supranational governance. And we know that responding to pandemics is this kind of complex link and interaction between these supranational structures, national heterogeneity in interventions, and then obviously kind of local and locally designed and locally adapted interventions into making sure the pandemics are kind of well contained. So how should all of these kind of three levels of power work together? And do you think that's been quite effective thus far in responding to COVID?
Yeah, so infectious disease response and the scale that has to be done with COVID-19 is largely also about governance. It's about logistics, it's about systems, and it's about how do you rapidly learn from observational evidence in terms of policy lessons of what works and what doesn't, and try to implement that in other settings. And the work involves obviously looking at modeling and looking at the developments in science and looking at behavioral science, because they're all crucial components, but tries to take kind of a more macro view on how do we bring all these different disciplines together to try to apply it to develop actual solutions for governments in terms of what they can do in the coming weeks and months. And I try to think of it this way. I mean, what I tell my medical students when they ask, what is global governance, is that if you can solve an issue at a local level, you should solve it at a local level. You have other problems that you can't solve at a local level, you need a national level. And then you have other problems that you can't solve at a national level, you need an international level. And that's where infectious disease outbreaks are clearly there, because obviously a problem of a cluster in Wuhan is as important to the UK government as, let's say, a small outbreak in Devon. And so I think this is kind of how you see the different levels, which is you start at the most local level needed, and then you accelerate upwards when you realize that actually you need broader cooperation. So it's just kind of looking at different levels of scale. You shouldn't bring everything to global level if it doesn't need to be, but clearly pandemics are a global phenomenon, as we're seeing, and we're all interconnected, not only from the health impacts, but also the economic impacts of this pandemic.
Absolutely. So then obviously, something that's maybe relevant to members of the audience who are from the UK, obviously what happened in the north, Andy Burnham, really shone to light the kind of local frustrations that people are feeling, rules and regulations and frameworks from high above, but then what does that mean locally? So how do you think certainly the UK has ascended or nested itself within the global context very well, but also acted locally appropriately?
Yeah, so it's quite interesting seeing the UK, because globally, it actually is quite a positive stakeholder in global health. I mean, they're one of the ones who committed to sharing of vaccines, who committed to multilateral cooperation, who have stood by the World Health Organization, even when former President Donald Trump was often pulling back from the agency and blaming them. So they actually have been a pretty good multilateral kind of partner in the current global health world. And that's a real, I think, credit to the government, also in terms of the vaccines, the commitment to making the AstraZeneca vaccine quite cheap and quite easily rolled out in poor countries. So I think that side is quite positive. On the flip side, I think some of the domestic politics have been so messy, because the feeling, people always say that the public health is here and the economics is here, but it's all interrelated, because you can't shut down sectors of the economy without financial support. And you can't implement public health measures. And if a public health measure says we got to shut down all pubs because it's spreading, without having the economic packages to support those people so they don't fall into unemployment and you don't get rising poverty. So it's all interconnected. And I think there has been a feeling domestically that the concerns of people in the north, the concerns of people in the devolved nations, whether it's Wales, Northern Ireland, and Scotland, are not listened to or prioritized as much as parts of the south. And that's created kind of an unhelpful tension currently, when we all kind of want to be on the same page that all lives matter, regardless of where you live. It doesn't, different parts of the country shouldn't be prioritized over others. And I think that's what the whole Angie Burnham kind of underlying tension revealed. The money wasn't being put on the table, but then a few weeks later, it suddenly became available.
So following on from that, and going back to kind of the global level, what does, and there's a question here from John Tassiolas, which kind of slightly pulls into this as well. So what does a successful response look like on an international scale that actually advances global health equity? So be that the way in which vaccines is distributed, a coordinated response on elimination or eradication. We've seen obviously the last couple of years steps back in global health equity. So how does COVID provide an opportunity for positive steps forward on the global health equity front?
Well, I guess the depressing story is probably we've gone backwards on a lot of the inequities. They've been both within countries and among countries accentuated by this pandemic. If anything, it pulled back the tide on issues that were already there, and then all just became very visible. And so I'd say what we would like to move towards. I think one is that every country in the world, even within Europe, is kind of doing its own thing. And I think we do need a globally kind of coordinated response to move forward on it. And WHO is trying, to be fair to them. I think they've done a remarkable job trying to bring stakeholders around the table. They had the World Health Assembly in May where there was a resolution agreed, which actually said that countries would share research products, and all countries agreed, including the United States, even though they were quite reticent. But then we see the vaccine purchases and we see that 80% are being done by rich countries, which doesn't really map on to what countries agreed to in the past. So I think, we can be optimistic of how do we create the structures, the multilateral structures, whether it's WHO or Gavi or Global Fund or COVAX, to try to elicit sharing from all countries. But in the end, a lot of it breaks down in the scramble for trying to get as much resource as you can for your citizens. And that's true within countries as well. As you saw, I think it was quite remarkable in March that healthcare workers working on wards, on COVID wards, weren't being offered COVID tests. So they would not know if they were positive and they were going home to their families. Whereas if you were wealthy enough to be in London and be connected, you could walk into a private clinic and be tested. And so it created this two-tier system, which I think everyone could say is unacceptable. If you're working on a COVID ward, you should have a right to a COVID test to know if you're infected and you might be infecting others that you live with or are exposed to. But it just exposed that actually sometimes money overrules, let's say, kind of basic ethics or even rationality.
Yeah, absolutely. So on John's specific question, when he says, when the vaccine eventually becomes available, it'll be relatively scarce. How should countries like the US and UK weigh the needs of their own citizens for the vaccine against the needs of people living in poorer countries? Is it okay to prioritize one citizen? So I think given it's very topical in the last week or so, it'd be great to sort of deep dive into John's specific question.
Yeah, well, actually, John, if I think it's the John I know, is probably the expert on this. So he's probably better question than me to answer. I mean, all I can say.
Question, John, then.
all I can say on it is that we should really have the vaccine going to those who are most likely to suffer the worst effects of COVID-19 and are most likely to be exposed to it. And if we learned anything through this pandemic, it's that wealth is the best shielding strategy. If you're wealthy, you can work from home, you can protect yourself with resources. And so I think we need to extend that from a national scale to a global scale, because we shouldn't just have wealthier countries vaccinate their whole populations and leave other pockets of the world empty. I think obviously we need to prioritize healthcare workers, social care workers, those in vulnerable groups, but it needs to be done across the world in a coordinated way rather than just kind of creating a whole bunch of hoarding by certain countries for their publics. And it's hard for governments. You can imagine in the UK, look at the demand for people asking, when are we going to have our lives back? So it's very hard in that kind of environment to say, well, actually, we're going to be sending vaccines abroad and you have to wait your turn, when people feel like they've suffered and sacrificed so much this year and they want to have access to the vaccine as soon as possible.
Yeah, absolutely. I mean, as someone who's currently sat in Oxford, I know it's not quite as simple as going up the road, but I sort of slightly wish it would be. So dovetailing on that, there's a quite good question from Val Pedrick. So do tell me if these are just all of your mates, by the way, Devi. But so has Devi noticed differences in levels of public cooperation in different countries that affect transmission of infection? So, a really good question is that around the question of why some countries do better than others, and I've seen you talk many times. It's very difficult to obviously compare across different health systems. Yeah. But is public cooperation a really important component in that variation and understanding the cause and the reason why some countries do better than others?
Yeah, so I think what's become clear is that trust in government and kind of community spirit, which play a hugely important role, because one of the boundaries of infectious disease outbreaks is it's not really about the risk you take for yourself. It's on the risk that you take on behalf of your communities and on behalf of everyone else you're around. So you are risking, if you take risky behavior, the person you sit next to on the bus, the healthcare worker that potentially might see you if you're in hospital, your flatmates. So it kind of comes to this thing as, where does selfishness begin and end in a pandemic? And I think this became really clear in the summer when you had people going abroad on holidays. And you could see that there were two kind of camps of people. There were the camps of people who were like, I'm going to live my life. I want to go abroad. I'm low at risk. Or, I want to do what I want to do, and I want to kind of live my life how I want to live it, which I think we all have heard people saying, right? Like, I have basic freedoms, and even invoking human rights. And then on the flip side, you had people who felt like they wanted to do those things, but weren't doing them to be responsible, who became resentful and frustrated because they're like, well, I am following the rules. And then it's all kind of intertwined when schools went back, because there were now quarantine arrangements in schools, which meant that if a child came into a bubble and they had been abroad, they potentially were seen as infectious. They had to quarantine 14 days. And so you had schools open and kids arriving who had just come back from countries where they should have been quarantining, but the parents didn't, put the child in school. And all of a sudden the whole bubble was sent home on the first day because there's one child who didn't quarantine. And you had a mix of parents who are like, well, we followed the rules, we stayed, we went abroad and did the quarantine period if we had done it. But now because one child didn't, we're all having to suffer. And all 30 kids are now home and home learning when my kid was so excited to go back to school. And I think there it's really hard for governments, because you're trying to kind of say, well, you're taking on the risk that that person took, and you're just unfortunate enough to be in that bubble. So I guess coming back to kind of just like the community idea of how much we're all interconnected in this, and how much when we hear people saying like, oh, I'm just going to do what I want to do, it doesn't fit, because you're taking on the risk of actually the whole community, not just of your own health and your family.
It strikes me as the UK is particularly strong on that feeling of anti-community maybe, and it might just be because we're all now taking a hard look at our own countries. But you look abroad, and you certainly look at Asian countries, or countries where the sense of community is a much more important part of the social fabric. Do you think public cooperation has been particularly bad in the UK, and that's a main reason why we've maybe done less well than maybe we should have done, especially compared to maybe our Asian counterparts?
Actually, I mean, I've been remarkably surprised by how good compliance has been.
Is that just because people in Edinburgh and Scotland generally are just way more friendly and into community, I suspect?
Well, maybe. I mean, in Scotland, actually, it was amazing. Like face coverings, they were brought in, made mandatory. By the next day, everyone was wearing them, no fuss. And if you look on buses, if you look in shops, people are just doing it. It's not a big thing. And so I feel, and my sense is actually probably the bulk of the UK is like that. I think maybe the media amplifies the voices who are extreme. You kind of have seen the silent majority who understand the severity of the situation we're in. And then you have a few extreme voices who are very loud, who get amplified. And so in a way might make us think that there's more of a division than there really is on these issues. But I think the bulk of people get that this is a serious virus, that you don't want to pass it on to people who are vulnerable. You see this also with the whole debate over Christmas now, where the headlines would suggest that there's a large group of people, or the majority of the population, want to have big Christmases and feel like the government is taking away their right to Christmas, when actually a lot of public polling shows people are being cautious because they don't want to infect their families and their loved ones, and they're making kind of judgments based on their appetite for risk, based on their vulnerability of maybe different family members, both from loneliness as well as from COVID-19. So I think it's more nuanced than perhaps the media might depict, because otherwise we wouldn't have seen the compliance that we have seen, which has been pretty good for both lockdowns. I mean, it's not 100%, but it's definitely upwards of 70%.
Yeah, grand. So the focus that some people have challenged with the fact that we have a very clinical view on the toll that COVID has taken on society. And many individuals who are anti-lockdown will say, this is at the expense of many other things. So second and third order effects. So that patient who's waiting for their cancer treatment, or the inevitable ramifications of recessions. And so obviously one measures what matters, and vice versa. So if we were to think of a slightly more holistic and effective way by which to measure success in responding to a pandemic beyond merely cases and deaths, maybe, what does that sort of measure really look like?
And I think that's completely right. I mean, I think even when we compare countries across the world, what does winning look like? For me, winning looks like you don't have massive unemployment or an economic recession, because we know that's bad for health, that you kept your health services functional for as many of the things it needs to function for, whether it's cancer or mental health or COVID-19. You've kept your excess mortality low, as well as kept your schools and society largely functioning. And there are countries who are winning at that in East Asia, or even if you look towards the Pacific, and some countries in Europe. I think Norway and Finland are quite interesting to look at. Denmark, examples of it, even in a European context where we're so connected and you might have land borders with other countries, that you can still do reasonably okay. But I think, I've gotten quite frustrated with the anti-lockdown rhetoric because nobody's pro-lockdown. Nobody's out there saying like, we want lockdowns, they're fantastic. Lockdowns are a last resort measure. And in some way, what you were hearing over the summer is that people who were calling for, herd immunity and shield the vulnerable and anti-lockdown have forced us into a lockdown because they didn't understand the hospitalization rate of this virus, which is that if it spreads past a certain point, you reach elderly groups. We know it seeps through, it starts with the young and seeps out. We saw it in the States. Everything's played out in different parts of the world in different times. You just have to look at other countries to understand where you are. Like right now with Christmas, just look at Canadian Thanksgiving. It happened. We can learn from other places. It's coming back, so it seeps out. Then you get your hospitalizations going up. And then all of a sudden your health services start worrying because they're like, uh-oh, our ICU beds are filling up. And the hospital, and also young people need oxygen. They may not need ICU care, but they might need a bed to get supportive care. And then all of a sudden you're forced into a lockdown. Whereas I think, in the summer, those of us who are saying, keep your numbers low, keep suppressing it, use your test and trace, use your border measures, tell people to be cautious, don't tell young people to get infected. We're trying to avoid that kind of pressure on health services that would cause a lockdown. So the irony, I guess I'm trying to get to, is the people who are most vocal about anti-lockdown measures, in a way, because of that messaging and the messaging about just get on with life, have forced us into a lockdown. Where if the messaging had been actually be cautious, don't get infected, let's try to open things up cautiously, we probably could have avoided a second lockdown because we could have been more cautious along that path. And it's just really hard to explain it in a 2-minute news clip because, you get asked like, are you pro or anti-lockdown? And I'm like, of course I'm anti-lockdown, but I'm also not pro-death. There's a balance to be struck there.
And so do you think that cases and mortality are a perfectly adequate way of measuring how a country's doing? Or do you think we could be better in thinking about some of the wider consequences and incorporating that into what is measured and what's presented?
Yeah, I think definitely we need a holistic indicator. But I think even if you look at the FT analysis, what you see amazing is the countries that have kept their COVID numbers low, including their deaths, have also kept their economies running and done really well. And the countries that have had uncontrolled spread have done really badly with their economies. Look at the UK and Spain. Sweden, again, is an interesting example. They tried to save their economy, and yet their economic hit looks the same as other countries, because other Scandinavian countries, because people change their behavior. And so their mortality per capita is much higher, but they didn't save their economy. And I think it comes back to the point that it's not the virus, it's not the lockdown restrictions that are killing your economy, it's the virus. And uncontrolled spread of the virus is probably the worst thing you can do, which is why case numbers are useful, because in a way they seem to correlate with other things that are important to keep, countries running.
Yeah. So I'm going to bring in a question here from Reese Green about the global comparison of death rates. So obviously the way in which COVID-related deaths are will vary significantly, and it's a highly politicized recording. Data is certainly biased in this respect. So Reese's question is, a lot of global comparisons are made, for example, death rates, but probably shouldn't. How is it even possible to be combined and standardize data globally? So if we're going to use mortality as a measure, how do we standardize that globally given the heterogeneity?
Oh, it's incredibly difficult. I think the only way you can really do it is through excess mortality, because if you just look at COVID deaths, if you're not testing people, then you don't know if they're dying of COVID or something else. And so I think all you can look at, as in previous years, how did mortality look like in the previous couple of years, and how does it look like this year, and then make a comparison. But even testing, like comparing case numbers across countries, is really hard, because in one of, former President Trump's genius moments, he's like, oh, you test less, you find less, and then you have less cases, and then you're doing better. And so of course that creates incentives, especially when you had these quarantine periods where if countries went over cases per 100,000, they'd be put onto the quarantine list. Then all your incentives out of country are to stay under that cases per 100,000. And you can do that by testing less, because we know there are all these asymptomatics, maybe 20%. We know there are people with mild symptoms. And we see this also with the debates now over, is our second wave larger than our first? And we can say, well, obviously in the first wave, we only tested people in hospital. Now we're testing people in the community. Liverpool is actually doing mass testing. There are 3 different testing regimes. You can't compare the numbers and say the virus has changed in terms of its hospitalization rate. It's just that we're looking for cases in a different way.
Yeah. So you did, you mentioned the US president, and I thought we'd wait a bit to do that a little bit later, but there's an upvoted by numerous people question from Ed Chalstry. So maybe we'll just quickly cover this now, but do you anticipate that the new US president will have a big impact on the global joined up response to the pandemic next year? So obviously this is a question that many people are very interested about in terms of how the US's involvement changes.
So I think it's both. I'm going to be a typical academic and say yes and no, which is, I think yes, because Biden has said on his first day he's going to rejoin the WHO. And one of the most challenging things I think over the past year has been Donald Trump's aggression towards the World Health Organization, withdrawing funding, withdrawing membership, attacking it constantly, undermining it, not being a cooperative player, not wanting to join COVAX. And so I think that's really positive. I think if I was within the WHO, I'd breathe a big sigh of relief, because that would have been a huge chunk of your budget and of kind of an important member who would have left. On the flip side, I mean, the US is a mess in terms of coronavirus. I mean, the number of cases they have, what was it, over 200,000 a day. I mean, the amount of misinformation, the people who think it's a hoax, how face coverings have become politicized, which, say if you're a Republican, if you're a Democrat. And I think looking at Biden's plan of what he wants to do, the team perhaps, because they've had such bad leadership, even with good leadership, this is a really hard virus to control. So even with having functional test and trace, even with having, science feeding into politicians, even with having restrictions with economic support, even with having border measures, as we've seen in East Asia, it's still hard. I mean, this is not an easy virus to solve for any country. And so I do wonder sometimes whether, his administration is going to be really consumed with solving the domestic problem of COVID-19, because it's not just the virus spreading, it's the misinformation and the resistance. And 70 million people voted for Donald Trump, who said basically COVID is a hoax. It's like flu. I mean, he still keeps saying it's not a big deal. Now it's sort of a big deal with the vaccine. I don't know what the whole anti-vaxxers are going to do about this. It must be kind of confusing their wavelengths, whether they want the vaccine or they don't want the vaccine now. But I think he has a huge domestic challenge. So I don't know how much bandwidth they have to engage globally, given the domestic challenges they face.
Yeah, I think that's a well summarized. So I'd be getting a telling off from the Turing, I think, if I didn't make us talk a little bit more about data and AI. So I think I saw a BBC article a couple of weeks ago that said, on the back of some Turing work, it said, this version of the COVID app takes advantage of a filtering process called the unscented Kalman smoother to screen out suspect readings. And I just thought, where are we in a world where that's like the first paragraph in a BBC article? But obviously we've now all become, armchair data scientists or epidemiologists, whether we're kind of qualified or not. But as we start a bit of a conversation about data, I was wondering if, Jessie, if you could bring up the second poll, which is what the audience thinks about in terms of how what we think kind of data, how data has kind of let us down or maybe helped us in our response to the pandemic. So the Slido's up there and the code is 6474. So that will kind of crop up in a moment. So do vote, but the kind of responses are, do we need better quality of data, better skills for data, better communication of data, or better public trust in how data is used? So that will kind of come up onto your screens in a moment. So whilst that comes up, Devi, a lot of dealing with pandemics is very real, it's very on the ground, it's very practical, and maybe some AI colleagues would be accused of being lofty and building overtly complex models for a purpose that doesn't necessarily need novel analytics. So for you, where does AI have a place in the response to COVID?
Well, this isn't my area, so you're probably going to know better than I am in this space, but I think, there have been lost opportunities to use for example, for contact tracing and understanding people's movements and where they might be going. Obviously have to play that off privacy, but I think, you know, South Korea, some of the apps that they've had in terms of tracking people and understanding their interactions can help us better understand who's actually been exposed to the virus. Because when you move from a lockdown basically isolates everybody, right? It assumes everyone is infectious and locks them in your home so you don't infect anyone else. And we want to move to a more precise data-driven approach, which is who actually is infectious and who are they most likely to have been around in the past week. So I think that's been a lost opportunity in terms of how could we have done that. But of course, with the trade-off of privacy, and we know that in general, South Koreans, you know, the public seems to have accepted the balance between you give up some of your privacy for your right of movement. And that seems as an acceptable balance. I think also with complying with isolation, that we know isolation is really hard for 14 days and a lot of people aren't doing it, for the vast majority of people from some surveys. So how do you actually support people through tracking apps, through checking in with them? You know, in the end, a lot of this has to be driven and shouldn't be overcomplicated. So come back to, I don't think technology solves all your problems in a pandemic. In some way, the countries that have just gone like, what do they call it? Boots to the ground, public health, you know, approaches of just chase that virus. Where is it? Who has it? Test them, isolate them, have done better. But if you can support that to make it easier through apps and through technology and through AI, I think that's the way we should be going. And that's what East Asian countries have been doing.
Yeah, Jesse or Dan, could you share the results of the poll? Just so you know, there's a very dedicated delivery man who's knocking quite a lot on my door. So I'm really sorry if you hear some quite aggressive knocking. I shouldn't have ordered a package to be delivered today. But okay, so overwhelmingly, people think that better communication of data is what could have maybe been more effective in the use of the data in responding to the pandemic, which I think certainly given how you've again, become a kind of front runner in incisive communication, I think we would all agree that we could have done a lot better in communicating with data. So your response thinking about how a kind of solely technocratic solution is obviously slightly missing the picture. There's a question that's risen to the front, to the top of the Q&A from Dylan, which talks about the test and trace app. Well, talks about the test and trace system, but his question is, how accountable should the test and trace system be for not managing the pandemic more effectively? So obviously test and trace is not solely an app, it's not solely data, that's an important component. But when you're marrying up together the technology and obviously policy interventions, it'd be great to hear your opinion about whether you think test and trace has received the level of accountability that it necessarily should.
So I think, you know, the centralized test and trace system that the UK government pursued has been, I'm trying to watch my words here, it's been pretty atrocious because we spent so much, I think like 22 billion on this, I think more than any other country. But it's not working because people aren't isolating. And so there's no point testing to find cases if you don't trace those and then get the people who are exposed into isolation. It has to work like clockwork. It has to work like it's a logistical exercise. And I don't understand why it's still not working, because I think we fixated perhaps too much on targets, like 100,000 tests or 200,000 tests. But you have to say, well, why are you testing? Because when you test someone, it doesn't really change in terms of transmission to others. It might change their own kind of clinical treatment. It doesn't really change anything for themselves because they've been infected, right? So, and if someone's been exposed, they've been exposed. And so for them to go into isolation as an act of goodwill, it's saying, I'm doing this to not infect others. And instead of rewarding it, and you can reward it through giving really good financial incentives, emotional support, hotel rooms, we've actually in a way even penalized it, because you end up having to lose your salary if you go into isolation or lose out on different opportunities of being able to go out. I mean, isolation is a big ask and you're doing it for others. And I think the test and trace system, even the way we talk about it, we say test and trace. We don't say test, trace, isolate. We don't say test, trace, isolate, support. And so I think this is where a lot of this, maybe the system's falling down. They spent time trying to get the testing stations up and going, trying to build these mega labs. You know, first they tried centralized contact tracing. We know it's much better at local level, but then you get to the isolation part. And I think that's where you really have to think creatively about how do you convince people to do something that's not really in their interest, but in the interest of others. And then you can introduce massive penalties, which we've seen, but that just makes people not want to get tested. Because if I'm feeling fine and I'm asymptomatic and if I know if I get tested and I'm positive, then I'm going to lose salary for 2 weeks. Why would I get tested? I feel fine. And so I think now you're seeing the same problem actually in East Asia. So Hong Kong, I think, is now something like, paying people quite a lot of money to try to get them to ensure they get tested. And because they're afraid that people will stop getting tested, because they're afraid if they get tested, they have to then isolate, or their contacts have to isolate. I wondered this sometimes with universities, because no one wanted to be the flatmate in universities who tested positive and then made all your flatmates go into isolation for 14 days.
No one wants to be that guy, no.
Yeah, so maybe when we saw, is that creating an incentive for people who are young and healthy who feel slightly off to say, actually, maybe I won't get tested because I'm not going to be the bad guy in my flat who causes everyone else to get, isolated for 14 days.
Yeah, absolutely. So some of that has brought in a few discussions around like the blind spots that we have, and the gaps in data have really, shone light on the gaps that we knew existed already. So be that social care, be that minority ethnic groups. If you had a magic wand, feels a bit too sort of flippant. Let's say a magic wand. If you had a magic wand to be able to fill some really key data gaps, if analysts tomorrow could get their hands on, you feel would have quite a profound effect on our ability to respond to the pandemics. What are some of those data gaps for you that would be filled or should be filled?
Well, right now, the biggest data gaps are first around immunity. I think immunity has been like the $1 million question. How long does immunity last? Can you get reinfected? If you can, does it have to be a different strain? How different does it have to be? Is a vaccine going to provide immunity? For how long? Will you have immune enhancement? What happens if your body sees it again? So that's one big gap, immunity. I just think it's like the $1 million question. And we have so much theorizing about T cells and about this. And I'm like, it all is plausible, but we need hard evidence and hard data. And I think less theory and more data. So that's the first one. The second one's around children. I think children are very puzzling in this pandemic. We don't have great data on actually why children seem to transmit less, why we don't see more clusters in schools, because you'd expect to see many more. Children seem to carry the same viral load, but what is happening with children? So I think that's a huge puzzle. I'd love data on really good on children. And do children infect adults? At what rate? Is it as much as adults infect adults? It just, from schooling data, it just seems like children are quite remarkably unaffected compared to other infectious diseases. And I think, the third area I would choose is around long COVID, which is also very contentious. So some people say long COVID is like an autoimmune response of your body to dead virus. So you constantly are ill for weeks and weeks. And we're seeing young and healthy people who suffer for months with this, and they don't even fully understand it. They don't feel fully listened to, or some of them have never even been tested because testing stopped. And then you have others saying, oh, this is just psychological trauma from lockdown and, prolonged restrictions. We don't know if the prevalence is 50% or 5%, that they're emerging studies. But I think if we had really good data on morbidity from SARS-CoV-2, this would help us develop better responses. So I think the three areas, if I had a magic wand, I would love to know about children, immunity, and long COVID.
Yeah, no, absolutely. There's a real broad range of questions, and I always feel really bad because now I've got lots of people who aren't going to have their questions answered. So maybe, and they cover everything from specific questions on how or why countries have done X, Y, Z, or specific examples about schools or universities. So maybe I'll ask you a broader question, and some people will feel like a component of their question is answered. But there's a sort of nice wee viral video of you. I think it's from Hay Festival in 2018, and you basically very accurately say, there's going to be some animal in China that infects someone who gets on a plane to the UK, and then it was all there to kind of that story was there to illustrate the kind of interconnectedness of dealing with a pandemic. But obviously now in the start light of 2020, that's a pretty accurate depiction of what a future pandemic looks like. So 3 things globally now that you think we could do better to make sure that this pandemic, and we'll inevitably have another one again, we could do better now, given your skills in premonition. What could we do better?
So 3 things. I think the first is we need to be more careful around animals and animal-human nexus. We know that there's some estimate over 1 million viruses circulating in animals, and at some point, one of them is going to jump to a human when they're in close contact, and that virus is going to sustain, or bacterial, or whatever it is going to sustain human-to-human transmission. And unfortunately, if it's a respiratory pathogen and you have those with minor symptoms, as we do with SARS-CoV-2, you create a absolute disaster that's very hard to stop. So I think the first thing, because I often think about when could we have stopped this pandemic? And I think that moment when that virus jumped is quite significant, because how do we stop that? So I think we need to look much closer at the regulation of animals and humans. And we see this also now in Denmark with the minks. I didn't realize it had 17 million that are kept in those kind of conditions. We don't need to worry about bioweapons, because actually they're being created every day in factory-like conditions like that, when viruses are being spread among animals in close holding and then spread to kind of low paid workers who are working in crowded conditions with these animals. The second thing I would say is travel restrictions. I think the public health community, including myself, completely missed that actually travel restrictions and border measures would play such an important role, because you could delay the importation and you could set up screening mechanisms to catch. And I think that will change in future pandemics, because the countries that have done better did introduce travel restrictions early on, and no country has been able to sustainably suppress this virus without having border measures. So I think that's the second thing. So first is animals, second is travel restrictions. And I think the third is actually looking at, the underlying inequalities, as we talked about at the start, that we have between rich and poor, between essential health workers, who's actually essential to society, what do they contribute, and also, the value of science. In the end, it's going to be the people who ran the recovery trial, who have developed these vaccines, who have developed the mass testing, the antibody tests, the T-cell tests, who are going to save humanity. All us kind of public health experts can do is buy time. We're buying time for them by saying we're going to delay this by 6 months, or we're going to delay it by a year. We can have delay strategies, and that's where public health is important, to prevent people getting infected. But to ultimately end the pandemic in a way that doesn't result in mass death, it's science. And so I hope that's also kind of a reaffirmation of countries to invest in science and commit to science, because you can't just build it up overnight if you don't have those kind of trained people in post.
Yeah, absolutely. And given your hit rate of accurate predictions, I would think we should all probably listen and heed that advice well. So we've got 3 more minutes. If we've got one last kind of question and poll for the audience, just because this is really front and center in people's mind around what to do during the festive period. So if my trained colleague could pop up the final poll, or if you're on Slido anyway, do have a look at it, which is: what summarizes your personal view on seeing family and friends during the festive period? I love you, and therefore I'm not going to see you at Christmas. I love you, and therefore I really need to see you at Christmas. I don't celebrate Christmas, or I never really loved you, so this works out pretty well for me. And just to let you know, Mum, if you're watching, I can probably look at who's responded to what, so I wouldn't say number 4 if I was you, Mum. So just answer that question. Obviously, Debbie, you've made yourself quite clear in what your opinion on the festive period is. So just whilst we wrap up, a kind of quick fire, because you are a person who has got feelings and needs holidays and sleep, and judging by both the love and also the bit of trolling I see that happens on Twitter, as well as a number of people who think you're a bloke, which I find very confusing how often that happens. Just a few little quick sort of silly questions. So don't think too hard about these. The lockdown habit you want to keep?
Walks, daily walks.
Daily walks. Lockdown habit you want to lose?
Not sleeping.
Not super good. How everyone's using like unprecedented and new normal. What's your most overused kind of pandemic related phrase?
Probably new normal.
Hey, new normal. Everyone who says new normal, go and do one. Where's your happy place during this dystopian apocalypse?
Oh, talking to family and friends.
Nice. And honestly, what have you binged?
Like food wise?
Food, TV, it's all up for grabs.
Smoothies, bizarrely. I've been like, I think I miss Miami or something. There's I think all of us are missing, are a bit homesick for where we came from. So I've just been making lots of tropical smoothies in the Scottish winter.
Nice, very good. Well, that's a lot more wholesome than the Crown or hamburgers. So if you could whip up the poll results. So we've got a very very socially minded audience. I love you, and therefore I'm not going to see you at Christmas. And 2% of you are sort of grumpy, mean people, so that's nice. So thank you so much, Devi, for your time and for covering a lot of ground. I'm sorry we weren't able to answer all your questions, but I hope that people feel that components of their questions were well answered. Obviously, continue the conversation online with the hashtag TuringCovidConf. We've got a little bit of a break now until I think 1:20, after which there is another very, very awesome person to join the panel, which is Christina Pargel, who will talk about her experience on Independent Stage. But But without further ado, a huge thank you, Devi, for your time. I hope you get more sleep. I hope you get a bit of a holiday, even if it is just traipsing around a wet and rainy Arthur's Seat.
Perfect. Thank you very much, everyone. Have a good day.
Bye.